Now, sickle cell. Let me just read to you the definition of sickle cell. Because when I was doing the research about the sickle cell disease, I realized there are so many definitions about this because one was saying a hereditary. Now, I want you to always take keen on the definitions. Why? Because when you take keen of the definitions of these diseases, you will easily know how to treat them or prevent them, because this is a preventive channel and not is more of preventive than curative channel. Okay, and then we take the longer route and not the shortcut or the quick fix, because in these platforms we don't encourage you to do anything that is called a quick fix. So listen, these are different definitions and I want you to just correlate them and understand. So the first definition was a hereditary blood disorder. Hereditary, which means genes. And all of you know, when we talk about genes, we say genes play about 2 to 10% of roles in health. The rest is coming in from, of course, diets. And actually, for you to activate genes that cause diseases, you must go through the epigenetics route. Epigenetics are the things that actually, the environmental factors that activate genes that cause you diseases. So genes play a 2 to 10% role, but the 2 to 10% role is actually played by 85% by diets, which are epigenetics, okay? And then the chemicals and all these things, the environmental factors. But listen to this. Sickle cell disease or anemia is a hereditary, you must inherit it, blood disorder characterized by the production of abnormal hemoglobin. A hereditary blood disorder characterized by abnormal production of characterized by production of abnormal hemoglobin. Now, on this note, they say the abnormal hemoglobin is S-shaped. It's actually an S shape. Okay. Now, listen to this other one. They say this. What is sickle cell disease? Sickle cell disease is a group of inherited red blood cell disorders that affect hemoglobin, the protein that carries oxygen through the body. Normally, red blood cells are disc-shaped and flexible enough to move easily through blood vessels. In sickle cell disease, red blood cells become crescent or sickle-shaped due to the genetic mutation. So at least here they have taken us back to the hereditary, right? Due to genetic mutation, the sickled red blood cells do not bend or move easily and can block blood flow to the rest of the body. Two things note here. One is abnormal red blood cells. Number two is hereditary genes. When somebody mentions to you about genes, simply know it's the easiest way to say, hey, this one, it's hard for us to get over it. This one, even if we give you drugs that cannot treat this one, the fault is not ours. We've tried. So always, any research that you read that talks about genetics and hereditary things, start to understand that they're actually washing their hands. Once you understand that, let's move on swiftly. So this other definition says, this S-shaped hemoglobin. So we've moved from the normal hemoglobin, now we have S. Remember, hemoglobin is not red blood cells. We have a red blood cell, and then inside the red blood cell, we have hemoglobin. Now, hemoglobin is the protein that carries oxygen. So it's the one that attracts oxygen, and then now the red blood cell carries that oxygen all through the body to deliver it to different sites. Now, that hemoglobin, that protein, is the one that gets the defects, is the one that gets the mutations, because genes control how this hemoglobin occurs or how it behaves. So the genes dictate the shape of this hemoglobin. But when you have a defect in the genes, and I told you sometimes back that most, if not all, genetic mutations hail from a messed up mitochondria. The mitochondria is the energy machinery of the cell. So anytime you're causing oxidative stress to the mitochondria, when you're not fasting, when you're not eating healthy, when you're eating inflammatory foods, you're causing oxidative stress to the mitochondria. Now, when you cause oxidative stress to the mitochondria, mutations begin there. Cancers begin there. That's where the problem is, and that's the reason why we tell you to fast. The prolonged fasts, they give you autophagy, which basically cleans your cells, and then they give you mitophagy, which is basically cleaning the mitochondria. And now you have a healthy mitochondria. Now your cell becomes healthy. You'll never have the mutations. You'll never know about the genes. You'll never know about the cancers. Human beings are not designed to eat all the time. We pass our characters to our children. It's unfortunate that many children now are being diagnosed with this condition, the sickle cell disease. And of course, we are passing it to them not because they deserve it, not because genes have become a big deal. No, because of what we've been eating. So the mutation that we are causing ourselves are actually being passed to these children. So if you have a sickle cell child, simply understand it started with you eating so many bad foods, the inflammatory foods. We'll talk about the diets in sickle cell. So this S-shaped already, it's deformed. So now we have the S-shaped hemoglobin. Now when you have that S-shaped hemoglobin, it is difficult to even get to maneuver through blood vessels. Now these shapes, the S-shaped, one, they have limited the amount of oxygen that will be attached to this hemoglobin. Because we need a normal shaped hemoglobin so that, and actually in children, you realize there's another hemoglobin called the F hemoglobin. That is, a child is born with the F. The normal one is F. But this one disappears within the 3 months of the child's life. So it disappears. It's a very healthy one. But now we have the S. And this S, one, it has limited the amount of oxygen that is being carried or being ferried by this hemoglobin. That is important because when you limit the amount of oxygen that is being attached to this hemoglobin, what is going to happen? This deformed hemoglobin, the S hemoglobins, they will start accumulating or coagulating together because they love coming together under circumstances of low oxygen. So when there's low oxygen, this already deformed or mutated hemoglobin start attaching themselves to each other and they form long chains. And these chains that they are forming are the ones that actually cause a defect in the shape of the red blood cell. Now we move from a concave, which looks like this, that actually takes or handles a lot of oxygen. We move from that to now a sickle cell or a crescent-shaped hemoglobin or red blood cell, sorry. So now we have this sickle cell. These red blood cells that are sickle-shaped, they look like a sickle. Those of you who have ever taken care of livestock, chunga ng'ombe, you know the sickle, how it looks like. Now when a red blood cell looks like a sickle or a crescent, its ability to maneuver through tiny blood vessels becomes a challenge. This is where problems begin because one, that sickle cell red blood cell has become very tiny and the surface area under which it ferries oxygen is now small. That is number one. Number two, its ability to become flexible and move into the small capillaries effectively is now limited. When that happens, now we have a problem. Now guess what? Some of these sickle-celled red blood cells will start clogging the arteries. They will attach on anything. And I want you to note here, if you're somebody who has already deformed red blood cells that are trying to struggle to maneuver through the capillaries and the vessels, and then you're somebody who is consuming sugar in all forms, and we said people who have diabetes, they undergo a test that is called HbA1c, which measures the amount of sugar that is attached to red blood cells, glycation. So imagine somebody who is still consuming sugar and then they have these deformed red blood cells. So that is double tragedy. Why? Because these red blood cells are unable to maneuver through the blood vessels and now they are sticking on the blood vessels wall. And now you bring in sugar that is going to make them even more sticky and going to make the density of blood become higher. So when you have a highly viscous blood and then you have deformed red blood cells, what are we going to expect? Disaster. Your guess is right as mine, a disaster. So therefore, sugar has to become the number one enemy to anybody or any child who is suffering from this sickle cell disease. As we go ahead, start understanding the concept, start understanding the reasons why I tell you to drop the inflammatory foods, sugar being number one on the list. Start understanding that. So now you have defected red blood cells. They are unable to carry a good amount of oxygen to ferry to tissues. So now the tissues start becoming ischemic. The organs start having ischemia because now there's hypoxia. There's low oxygen being ferried towards those tissues. And now parts of those tissues or those organs start to die. And that's how we end up getting multiple organ damage and deaths due to multiple organ damage. Thank you so much for that. Multiple deaths from multiple organ damage as a result of sickle cell anemia. Once you understand that, you will know how to reverse this and how to actually prevent the occurrences of this, and even how to know you'll understand how to not to spread these defective genes to your children. Okay? Good. Now, in your body, there's this organ that most of you don't even pay attention to. Nobody pays attention to that organ called the spleen. There's a small organ in the body that is called the spleen. But this spleen plays a very important role there. So the spleen keeps macrophages, or the white blood cells that actually engulf microorganisms. They destroy microorganisms. That is one. Apart from it keeping it, it also keeps or stores blood. So the spleen also stores blood. But another function is the spleen filters the same blood. So it filters things from the blood. Just the same way the kidney filters toxins and the proteins in blood, the spleen also plays a filtration rate or role in the blood, or with blood, or on blood, whichever the English. And then the spleen also regulates ion balance. So when you have high ion in the blood, that's the function of the spleen, to regulate it. When you have low ion, it's the function of the spleen to regulate that. Yeah, so we clear infections, we store blood, we store immune cells, we filter blood, and then we store the blood also, right? Once you've understood that, you will know the spleen actually another role for the spleen is to clear damaged or old red blood cells. Remember, red blood cells have a lifespan of about 120 days. So when you have a lifespan of about 120 days, it means after they have aged, they have to be gotten out of the system. So they have to be cleared, and the spleen is the one that clears them out. Also, other red blood cells that have a defective shape or form, they are destroyed by the spleen. What does that tell you in sickle cell anemia? It tells you that those sickle cell red blood cells are actually going to be destroyed. Most of them are going to be destroyed by the spleen, right? Because they are defective. And this is where anemia comes in, because when they are defective, it means that they will be destroyed, and therefore the ability of ferrying oxygen from the lungs through the blood into different organs is now affected. And when that is affected, we have a problem. Okay? So that means now tissues and organs will start to die. And when they start to die, now that is death just looming. We are actually creating room for problems. Now you realize the symptoms of sickle cell are actually related to this shape, these deformed red blood cells. That is one. They're also related to the low oxygen supply towards tissues, the joints, and all that. And we'll talk about the symptoms and we'll get to understand it even clearly. The spleen is usually enlarged. Yes, it's called splenomegaly because one, you're actually causing a lot of stress to this spleen to just clear these defective red blood cells. So it's becoming difficult for it to actually handle this problem. Okay? And then, of course, you're limiting blood flow towards the spleen again. And not only does it enlarge, sometimes you can get already you don't have a spleen. So it actually shrunk and disappeared. Why? Because we are not supplying it with nutrients, we are not supplying it with blood. Now we have problems with the spleen. So it's either enlarging or just disappeared. But when it's an enlarged spleen, there are other functions, there are other diseases and conditions that can actually cause an enlarged spleen. Okay? So that's the topic for another day, and we can talk about it another day. So what are the causes of sickle cell? Now that you've understood the mechanisms under which it happens, what are the causes of sickle cell anemia or sickle cell disease? Of course, mutations. Where are we getting mutations from? Defective mitochondria. Where are we getting defective mitochondria from? Diets. Children eating sugar. Children eating MSG through the pizzas. Children taking margarine. Children taking the peanut butters that are processed. Children eating those cubes, the spices that you use to make food taste different. You people consuming a lot of alcohol, a lot of seed oils, a lot of wheat products, and those inflammatory foods that actually affect the cells from the mitochondrial level all the way up. And now when you see a mutation, we focus so much on that mutation and we don't focus on where it's actually coming from. So when you focus on the mutation, we start treating the mutating cells, but we are not treating the cause of the mutating cells. And this is where the health system totally get it amiss. We start focusing on the symptoms of sickle cell, trying to enlarge these red blood cells by giving you hydroxyurea, trying to supplement you with oxygen to try and just open up these cells, trying to do a bone marrow surgery or bone marrow transplant to just do away with these defective red blood cells. But the question is, where did they come from? Because the conversation is always what is causing them rather than what are we supposed to do to fix the symptoms. When we give you those painkillers every time, we are fixing the symptoms of sickle cell. When we give you those antibiotics all the time to prevent you from getting infections, we are actually fixing the symptoms, because low immunity is actually a function, is actually a defective spleen, is actually a liver problem, and it's actually a dietary problem. So if we fix the causes of the defective cells in your system, that becomes easier for us to handle this disease and prevent it, and even prevent the occurrence and the spread. But all of us are focusing on this, and I will talk about hydroxyurea as we go ahead. Urea is actually an anti-cancer. And some of you, when you are admitted with COVID, let me put that in quotes, you are given a dose of hydroxyurea. It was actually being used, tested for COVID, and they said it's effective in COVID. Did you know that hydroxyurea is actually an anti-cancer? It's called an anti-neoplastic agent. Did you know it's an anti-cancer drug? Did you? So we'll talk about that. Okay? So what are some of the symptoms of sickle cell? If you have a sickle cell child, you will understand. Because the pain that they experience in their joints, in their muscles, in their arms and feet is so bad that you look at this child and you start just feeling so bad about it. So now this child has to take drugs for a lifetime because they're trying to prevent the symptoms. But nobody's fixing the dust. How many of you have sickle cell children? Children with sickle cell anemia or sickle cell disease, but you're still having that vegetable oil in your kitchen. But this child is addicted to wheat. But this child takes milk every morning in tea. But this child is a sugar addict. Actually, you give them cakes to celebrate their discharge from the hospital. And you give them a cake. And they eat a cake which is a combination of sugar, seed oils, and wheat. Huh? And you've written on that cake, happy warrior, I don't know what, hey, a survivor of sickle cell. And now you cut the cake and the child eats that plus soda. The one that is the black currant one, right? Because it will add him blood. Because now he has a problem with blood and anemia. Now you give him Ribena or the soda, black currant. So that it adds them blood so that they can survive this disease. How many of us do that all the time? You even carry that soda to the hospital to give it to them. You give them the fruits and all these things and bread, brown bread that is applied with peanut butter and the jam. You call it a jam, right? Because it's fortified with vitamins and the folate, because folate is good for blood levels, right? So you give these children folate rich foods, folate rich foods, the fortified ones, brown bread. We talked about the fortification of foods on that other channel. And somebody got upset, right? So they fortify food, they remove the nutrients and they add in now synthetic nutrients, and you think that is fortification. But those are the foods that you're feeding our children. How many of you feed your children with breakfast cereals plus pasteurized milk? And then we start wondering, where are we getting these defections from? And we think hospitals come to change this, right? Listen, health is in you going back to what your grandfather and your great-grandfather used to do. Health is not in the research, in the syllabus, it's not. Actually, you realize more health is outside the syllabus than it is inside the syllabus. We've questioned the syllabus here multiple times. I personally have gone through that syllabus, so I don't question what I don't know. I've gone through it. And now it's time for me to question it, because some of the things in the syllabus don't make sense. But because we have that old professor who is going to push that information in you, we are as good as our mentors. This professor who pushed this information into your head is the same professor that is going to push more of these things during internship. So you become as good as him, just pushing and regurgitating the syllabus and all that, and becoming so tough because now you've studied, you are educated. But did you know intellect is evil? Common sense is godly. Where is the common sense when medicine comes in? We rely on our own intellect because we are professors, we are doctors, we understand medicine. So we rely on this to actually exploit the people that God put us in this position to change their lives for the better. There's a day I said that my role is to glorify God through easing pain and suffering from the people of God. My role here is not to be called Dr. Lewis. No. My role here is not to be the best that I've ever been in my field. No. My role is to ease pain and suffering from God's people. That's how I glorify God. And when you get better and you tell me, thank you, Dr. Lewis, I tell you, no, it's not about me. It's about your effort. So if anything, or if any case, you're supposed to glorify God when you get better, not Dr. Lewis. Sometimes I rely on intellect and common sense escapes my head. And in such cases, common sense has to play a major role here. Common sense has to play a major role here. And as we continue, you'll see why I'm saying that. So these are some of the symptoms of sickle cell. Number one, intense pain. Where are we getting the intense pain? Like literally all over, in your chest, in the bones, in the joints, in the abdomen. Pain literally all over. If you have sickle cell, nowadays they've said that now you can actually live to about 40 to 50 years. Look at that. Look at that mode of fear. How do they sell fear to you? They tell you that your children will not survive beyond 20 years because of a certain disease. Let's say this sickle cell. They will not go beyond 28 years, right? Selling you fear. And then now they tell you, because there are people who have survived it, because they have changed their kitchen, they now change their game. And they say, now you can go, a sickle cell person can go up to 40 and 50 years. Now, no one has control over your life. No one can put such judgment onto your life. No doctor knows when you will die. No doctor knows when you will die. No hospital knows when you will die. We can see your organs are multiply failing. They are failing totally. We would like to sell you the hope that you will survive. We know you're going to die, but we don't know when. We also know, in that doubt that we know you're going to die, we also know you can survive. The only thing that we know is, that we don't know is, how are you going to survive? Because we know, the more we pump drugs into your system, of course, we are going to facilitate your death. But are we ready for that conversation? We are not. So we know your organs are failing. You have multiple organ failure. We see your liver is failing, but we will still give you drugs to kill the same liver. Right, Daktari? And of course, maybe it's not the problem with the doctors. It's actually how the system is designed. Because if you don't pump those drugs, of course, the system will come against you. Your licenses can be revoked. Why didn't you, if you're a pharmacist, why didn't you give these drugs? They were supposed to save life, right? But we know these same drugs were supposed to go through the liver. And the liver is already failing. So we know that. But we are asking this pharmacist, why didn't you dispense these drugs? So the pharmacist would rather give out those drugs. That's why they are drug sellers. They are legal drug sellers. They don't dispense drugs anymore. They just sell drugs. That nurse knows if she doesn't administer that drug, she will be questioned. Did you administer these drugs at this time? The answer is no. License revoked. Problems. Cases in courts. And that's why nowadays nurses the nursing profession stopped being a calling. It's just now drug administration. Simple. Administer drugs. Time to ask questions. Anyway, very, very, very painful joints, painful chest. You feel like you're clogged in the chest and muscles are paining, your joints are paining, pain all over. And sometimes when you're diagnosed with this, it can be taken as another disease because pain in the joints and the muscles is actually a general symptom. But we'll get closer to it, we'll go deeper into it, and you'll understand the differential diagnosis. Anyway, number 2, anemia has to be there. What is anemia? Reduced red blood cells. Reduced red blood cells, that is anemia. So this one, not only do we have reduced blood cells, the red blood cells, we also have defective red blood cells. They are looking like a sickle, they can't carry oxygen, so therefore you have blood, yes, but your tissues are dying. They are dying because there's no supply towards them, of oxygen towards them. So you have defective red blood cells, and then you have less red blood cells because the spleen is actually clearing these defective blood cells. So anemia is part of it. Number 3, infections. Why? Because the spleen keeps the macrophages that actually clear the microorganisms that cause you diseases. So if you have a defective spleen and also you have a defective liver, what do you expect? Very low immunity, okay? So that's a problem. Number 4, swelling in the hands and the feet. Sometimes when you swell the feet and we push that swelling, that edema, and it forms a hole, we call it pitting edema. So that is a kidney disease symptom. But sometimes somebody is just having general edema in the legs and in the hands, and you're thinking, oh, maybe it's the blood pressure. Maybe it's the kidney problem. We do all this, they are normal. But then this now comes into question. What else can cause swelling of the legs and swelling of the hands? Are there blood clots that are actually causing blood not to come back? Is there DVT? If we rule out all this, now we go to sickle cell and see what is actually happening here. Another symptom, men, This one is for you. There's something called priapism. I don't know if this is a positive symptom or a negative one, or both. Priapism. Priapism is having a prolonged erection, but a very painful one. So, man, I don't know. Some of you might think that sickle cell is coming in to solve erectile problems, but you have now a strong erection, but it's a very painful one. It's called priapism. So when you see this, start questioning. And then, of course, in children, sometimes low IQ. Low IQ because, of course, blood supply towards the brain is limited. The brain needs nutrients. The brain needs oxygen. Okay, the brain needs all this supply of nutrients that are carried by blood and oxygen that's carried by red blood cells. But now you've limited oxygen supply towards the brain, and now you start having these retarded children. Poor vision is part of it because, again, you block the blood supply towards the eye, and now the eye tissue starts to die. And then delayed growth in children. Some of those things that you experience in your children, the delayed milestones, they don't talk faster, they don't walk faster, or in the good time, are actually symptoms of sickle cell. And apparently, just like cancer, when you're diagnosing sickle cell, sometimes it comes in very late. Okay? Comes in very late. But it's time for us to unlearn.